Hello everyone. Today we are going to deliver. Today I'm going to deliver my lecture on Introduction to Hospitals. Basically, it is a topic of Chapter 1 of Hospital and Clinical Pharmacy, under the syllabus of D Pharmacy second year. We are going to discuss the various topics come under the introduction of hospitals. The first topic is the definition of hospital. Second one is the functions of hospitals. Third is the classification based on various criteria. We are going to discuss the various criteria on the basis of which we can classify the hospitals. Next one is the organization of hospital, how we should organize the hospital. And next is the management and health delivery system in India. In this video, we are going to discuss up to the classifications based on various criteria. So first of all, what is the meaning of a hospital? What we understood from the hospital, we all know it's basically hospital is a place where a sick and injured person go to treat himself or herself. So basically where the word hospital comes from, it is derived from the Latin word hospitalis, which in turn derived from the French word host, that means a host or a guest. A host or a guest is basically a patient which goes to the hospital to treat himself. So how we define hospital? Hospital is an institution which is scientifically and economically organized for prevention, diagnosis, and treatment of diseases, where we prevent the disease, we diagnose the disease, and finally treat it. So basically, hospital is a healthcare institution which provides the treatment to patients with specialized staff of physicians, medicine persons, doctors, nurses, and the various equipment. The teaching hospitals are the places where the facilities are provided for the teaching, training of medical, paramedical students and the trainers. So hospitals may be operated by the government or the private agencies. There are hospitals which are operated by the government agencies such as the PGI, Chandigarh, Government Hospital, Amritsar, Government Hospital, Patiala is there, and the private agencies such as DMC Hospital, Ludhiana. So there are various hospitals which are operated by the government or the non-government agencies. Next topic is what are the functions of hospitals? So the first function, which is the primary function of the hospital, is concerned to provide the patient care. Okay. It refers to any type of care given to the patients by the health team members, example, physicians, nurses, dietitians. So all the care provided to the patient is the primary function of the hospital. Second function of hospital is to diagnose or finally treat the patient. Okay, so it provides the diagnosis and treatment of diseases of the patient, both inpatients and the outpatients. Next is the education provided. Okay, basically it's also a very important function of hospital. It provides the training and educational courses for the professional and technical personnel who provides the health services. Again, who provides the health services? They are physicians, dietitians, or the nurses. So there we can also provide the education to these people. Next important function of the hospital is the medical and the nursing research. So the hospital is also concerned with conducting the health related researches that focus on the improvement of the health or prevention of diseases. Other function of hospital is to prevent the disease and promote the health. Okay, hospitals basically lower the incidences of diseases through early detection and treatment and concerned with the health promotion. Hospitals are geared toward providing the preventive services through a community health centers also. Other function is rehabilitative function. What is rehabilitative function? Rehabilitation services are dedicated to provide high quality, individualized and effective intervention aimed at promoting both patient safety and a return to independent services. What type of services? Including the physical therapy, occupational therapy, and speech languages. So these are the main functions of the hospitals. There are other functions also, like it raises the quality of law and general standards of medical practice. Other topic Next topic is basically the classification of hospitals, how we can classify the hospitals. There are various parameters to classify the hospitals. As you know, there are a wide range of hospitals are there. Some of the hospitals are very small, some big, some medium, some are operated by the government agencies, some are operated by the non-government agencies. Some provide the only patient care, some provided also the training and teaching facilities. So we have different parameters. According to that, we can classify the hospitals. So the first parameter, which is very important parameter through which we can classify, is according to the ownership and control. Ownership is who owned the hospital, right? Who owned the hospital? So there are two types of hospitals according to that. We can classify according to this ownership and control parameter. The first one is government hospital. Second one is non-government hospitals. Government hospitals are also called as public hospitals. They are basically run by the central or state government, local bodies, and public sector undertaking. They are owned, administered, and controlled by the government. They provide free care to the patients. The government hospitals are owned by the Ministry of Health, the universities also, or the other things. Okay, so basically, it's a hospital which also provides medical care free of charge, free of cost, which is in some places the cost is also covered by the government reimbursement. Second, we can classify them as non-government hospitals. Non-government hospitals are further categorized into voluntary nursing hospitals, nursing homes, and the corporate hospitals. Okay, so what are the voluntary nursing hospitals? Voluntary nursing hospitals are basically owned and managed by the these hospitals are registered under the Societies Act or Public Trust Act. They are run by trust and non-commercial basis. Example are charitable hospitals, right? So they are basically run by the various trusts. Okay, so they are non-profit basis of hospitals. Other one is the nursing homes. Nursing homes are generally owned and managed by the individual doctors. Maybe they have a specialization in one field, so they started their nursing homes. There are many maternity care hospitals are there, nursing homes are there. So these hospitals do not admit the cases of medico-legal importance. Medico-legal importance, police cases or the accidental cases, right? So they do not admit that type of cases. And the patient care services are usually provided in some of the specialities of medicines. Some of the nursing home, as I have already told you, provide only maternity care. Some hospitals even provide tertiary care in some super specialities like cardiology, nephrology, etc. Third type of hospitals are the corporate hospitals, which are public limited companies formed under the Companies Act. So these hospitals are basically the profit earning hospitals and are registered under the Companies Act. Examples are Apollo Hospital, Fortis Hospital, etc. So this is our first parameter according to which we can classify the hospital. The next parameter according to which we are going to classify the hospitals are that according to the directory of hospital. Okay, so according to the directory of hospital, we can classify them as general, rural, specialty, teaching hospital, isolation hospital. Okay, general hospitals basically are the hospitals which provide the medical care in more than one broad specialty, and there is no strict departmentation in there. They are meant to provide wide range of various type of healthcare, but with limited capacity. The care for patients with various disease conditions for both sexes to all ages, medical, surgical, pediatrics, obstetrics, eye and ear, etc. Usually, general hospitals are devoid of super specialist medical care. Next are the rural hospitals. They are the hospitals which are located in the rural areas. Okay. Third are the specialty hospital. What are the specialty hospital? As its name suggests, it provides the medical care usually in one or more specialty. Okay, it may be like particular condition, like orthopedic hospital is there, maternity hospital is there, pediatric hospital is there, cancer hospital, eye hospital, etc. Next hospital in this parameter is teaching hospital. We can also say them as a teaching cum research hospital. Actually, in this hospital, college is attached for medical, nursing, dental, pharmacy, education. So in these hospitals, they are attached to the medical colleges. Again, their main objective is to provide medical care along with the teaching and research. Last type of hospital comes under this category is isolation hospital. Hospital which provide patient care to communicable diseases are the isolated hospital. As you know, nowadays there is one trending disease, COVID-19. Okay, in that these type of patients are placed in isolation hospitals, where the chances of spread of that disease will be rare. Third type of classification, third type of parameter according to which we can classify hospital is according to the systems of medicine. There are very traditional types of systems of medicines are there, like Ayurvedic medicines are there. So according to them, we can classify them. Like allopathic hospitals are there, Ayurvedic hospital, Unani hospitals, homeopathic hospitals, and or the other systems of medicines are there. Next parameter is according to the size of hospital. So we can classify the hospital according to their size also. These hospitals are based on their bed strength. Okay, like if the hospital have less than 200 beds, they are known as small hospital. If they have more than 200 but less than 500 beds are there, they are known as medium hospitals. If they have more than 500 beds, they are known as large size hospitals. Next parameter is according to the level of care. So what type of care the hospital is providing, according to them, we can classify them as primary care, secondary care, tertiary care hospitals. Okay, so what the primary care hospital? Primary care hospitals provide the day-to-day health care given by the healthcare provider. Typically, this provider acts as the first contact and principal point of continuing care for patients within the healthcare system and coordinates other specialist care that the patient may need. So they basically provide the basic health care. It is also generally regarded as the gateway to receiving more specialist care. Example, PHC and CSC regional hospitals are come under this category. They are usually 50 to 200 bedded hospitals. Okay. Next type of hospitals are the secondary care of hospitals. Okay, these type of hospital provide the first level of referral services. Okay, they have generally a multidisciplinary hospital which provides medical, surgical, obstetric, pediatric, and orthopedic services, and it provides all kind of services including the medical research. In addition, it has advanced diagnostic services, a high-tech pathologist labs, specialized radiological and other departments, sonography departments. Third is tertiary care hospital. They are highly specialized services. They provide the highly specialized services at the regional or the central level hospitals. Secondary care hospitals are district level hospitals. Tertiary care hospitals are regional or central level hospital, or you can say the national hospitals. So they basically deal with the highly specialized services. Okay, they provides all the services offered by secondary care hospital along with one or two specialities like cardiac care is there, GI tract surgeries are there, eye surgeries are there. Along with this, next parameter is based on the length of stay. How we can classify the parameter according to the length of stay. Okay, so there are some short-term or short-stay hospital. So in these type of hospitals, 90% of patients stay for only less than 30 days. Okay, and the second one are long-term or long-stay hospitals where the 90% of the patients stay for more than 30 days. Okay, like mental care hospitals are there. Next category, according to which we can classify the hospitals, are based on their cost. Okay, so based on their cost, there are two types of hospitals. One is elite hospital, or the second one is budget hospitals. What are the elite hospitals? They are also known as 5-star hospitals. Actually, they are the symbols of high technology and advances in medical sciences. They have deluxe rooms equipped with TV, telephones, and refrigerator. The rates vary of these hospitals. Like room rates vary from 500 to 1200 per day, or the more. Next type of hospitals are the budget hospitals. These hospitals are meant for moderate budget and low budget persons. Example, civil hospitals or the charitable hospitals. Okay, so these are the hospitals which are classified according to the cost. So up to this, there are different classifications of hospitals. We can see that, okay, and according to their different parameters. So I hope you understand this properly, and thank you. We'll again come for our part 2, where we discuss the organization and the management of hospitals. Thank you so much.